There we go. We're recording now. So, like I said, it's the UHC IESNP for the second time in about a month. We'll move on to other topics for our webinar after this. The reason I'm doing this again is we learned some things about the plan since I did the last one. So I think this version is going to be a little more helpful. Not that the other one wasn't, I don't think. I'm biased though. But anyway, so let's get started. So before we get started, a couple things. If you have questions, if you come on and you have questions, just send them into the question box. I will answer them at the end of the presentation for you. This presentation will run probably about 20 minutes. If you miss this or you jump in, after it starts, we put all our recordings on YouTube. So that's at Crowe Medicare on our YouTube channel, or if you want, you can just Google YouTube, Crowe and Associates. We put all our webinars up there, everything. So when you get a chance, scroll down through them, even subscribe if you'd like. I like to have more subscribers. And let's get started. So our agenda for today. So we're going to go over the UHC IESNP plan. What does that stand for? Institutional Equivalent Special Needs Plan. We'll go over the benefits, the availability, who has access to it, who's eligible to enroll in it, how you get ready to sell. I already mentioned that our webinars are recorded and put on YouTube, so I won't hit that again. Just a quick reminder that AHIP is out. It's been out for a while now. I did do a YouTube video on the test tips for 2024. It's pretty straightforward. I think if you watch that video, you shouldn't have much trouble passing AHIP. It's tedious, but it's easy. But it does take a while. I will warn you on that part. For those who want to do in person, we're going to start rolling out for this UHC IESNP. We're going to start rolling out meetings. I just wanted to mention two of them. We have two coming up in Connecticut. They're lunch and learns from 11 to 1. Serena is going to be doing those for us. Thank you, Serena, in Connecticut. But any Pinnacle or Crowe agent is free to welcome to attend, I should say, or any agent for that matter. The first one is on July 26th at the Delamar Hotel. Serena said that people would know where that is. That's in West Hartford. I don't think I've ever been there. And then the second one is 727, another place I haven't been. I've been to Hotel Zeros, but never the one in Norwalk. So those are from 11 to 1, lunch and learns to go over the product. I do see there's some questions coming in. I will answer those at the end for you, I promise. And also, I should mention, we're going to do in-person meetings in other states as well. We're in the process of rolling those out. Okay, so the UHC IESNP plan, this is a 5-star plan. Its current states are New York, Pennsylvania, New Jersey, Connecticut, and Florida. If you are in Connecticut, this plan traditionally has not been commissionable to any agents. It is going to now be commissionable, but only to Crowe and Pinnacle agents. So no other uplines agents, other than uplines that go through Crowe or Pinnacle, can sell this and get paid for it. So it's exclusive. But if you're in Connecticut, do not sell it until further notice. Don't sell it until we're shooting for the end of July. It's been refiled in Connecticut later than the other states. It's good in the other states right now. But in Connecticut, if you sell it, it's available. If you sell it, it won't pay commission. So wait till we let you know it's commissionable. It's a PPO plan design, same commissions as every other plan. Big selling feature on this plan is the out-of-pocket max. So you can sell this to duals or non-duals. But, and obviously if somebody's a QMB or a full dual, they have no copays or anything anyway. But if you sell this to a drug help only or a non-dual, the out-of-pocket max is the key. It's $1,500 in some states, $1,600 in others. In some states, it has a dental benefit up to $3,500. Dental benefits as low as $2,400 in some states. I'm going to show you an example. $200 quarterly OTC, 36 one-way trips for transportation, $300 vision benefit, $2,000 hearing benefit. Strong plan, especially so it looks like a dual. But for people who don't get any help or just who get drug help only, this thing is going to be incredibly competitive. Is the wrong word. It's just better, in fact. Okay, it's going to be available in a number of states in about a month, less than a month, in fact. And on the next slide, I'll show you a map of that. UHC is really going to roll this thing out, so they'll have a number of states rolled out prior to AEP. There is a clinical aspect to this plan. Some people have asked, why don't they just roll it out in every state and every county? It's because of the clinical aspect of it, meaning this plan, one of the things that made it a 5-star plan is they have a clinician. That'd be either a nurse, nurse practitioner, or a PA is available, a UHC employee, either a UHC employee, and they are available to meet the members on this plan either at their home or at the facility. This plan is available to both. And they will not just meet them one time, it's an ongoing thing. So United has to be staffed up in a given area to meet the requirements to be able to offer this plan. So it has slowed the rollout of it as a result. Again, access to the plan is limited to Pinnacle partners, so Pinnacle agents and agencies, and Crowe agents and agencies. Here is the map. So the states that are available as we speak, I showed you earlier. However, prior to AP, the plan will be available in all the blue states, and then they're adding Kentucky, Oklahoma, and DC for 2024 expansion. So they're really expanding it, but again, that clinician component of it is going to slow that expansion down. But even having said that, they're still doing a great job of adding employees who are clinicians, either a nurse practitioner, or PA, to service the members, which is a requirement of the plan. I'll go back to the map for 1 second just so you can look at it. Okay, so the UHC IESNP plan is a special needs plan available to institutionalized people and those that require assistance with activities of daily living, or IADLs, which we're going to give you examples of that. So you can enroll somebody in this plan if they're in assisted living, home health, receiving home health care, a memory care unit, or in an independent living facility. It's available to dual and non-dual members. I think the big appeal for this plan will be drug help only and no help at all people, because of the benefits of it. It's something that they can't get anywhere else, benefits-wise and out-of-pocket max-wise. This plan can be sold to members at home who qualify based on need. So if somebody can't perform ADLs, which I listed them there, or if they have the inability to perform IADLs, I forgot the I on there. The second one's supposed to be IADLs. And those are basic self-care tasks. And I gave you some examples: housekeeping, managing money, food prep, managing transportation, managing meds. I'm going to give you a list of them. Actually, it sounds like I would probably qualify for the plan, but you'll see it'll be widely available. It is not nearly as restrictive as people think, and this plan will be a good option for a lot of your current members and a lot of potential prospects. Okay, so what are IADLs? I should have said what the acronym stood for, but I actually forgot as I was doing this presentation. Instrumental activities of daily living. That's activities that support daily life and are oriented towards interacting with your environment. So examples: care of pets, care of others, child rearing, communication, you can read them, but financial management, shopping, meal prep, keeping the home clean, managing your bank account. There's a great deal of things, if people can't perform them, that would qualify them for this plan. So when you're trying to qualify people, the way you do it is you first check Jarvis for eligibility. Now, what Jarvis will do is it will show if people are eligible initially just through Jarvis at the first level. And in other words, Jarvis will know if this person is a full dual or getting some level of help and they qualify. It will show automatically in Jarvis. So you don't have to do any other steps then. Jarvis will show they're eligible. You can enroll them. If you go into Jarvis and it doesn't show them as eligible, then they can qualify based on an assessment. And the assessment is a phone call that's done by a UHC vendor called WellSky. And WellSky is going to basically talk to that vendor or to that prospect and see if they're eligible based on ADLs or IADLs, that list I went through. So the agent will request a phone call from WellSky to the prospect, and then the prospect is verified if they qualify for the plan, and they are not re-verified. It's a one-time verification. So once they're in, they're in. I mentioned already the clinical aspect of the plan. I won't dwell on this topic too much, but in other words, this isn't like where a nurse calls and says, I'm going to meet with you one time to go over your meds. They have a care coordinator who will coordinate care for the members either in the facility or at home, help with things like manage medications, determine how often that nurse practitioner, or PA needs to come to the house. Like I said, it's not a one-time thing. Maybe they need to come quarterly. Maybe they need to come monthly or weekly. So it's a big benefit to members, and that clinician is an employee of UHC. It's also a big benefit for those who are institutionalized, that are in a facility. It's a big benefit for the facility because it extends the average stay by about 6 months because there is constant evaluation going on. So the facility likes that part, and it is a great speaking point to talk to a facility about contracting to offer this plan. And the idea hopefully would be then you would have exclusive rights and ability to offer that plan to members of that facility. So increases the stay. And then one of the bigger things, and I didn't even understand this was ever an issue, but when somebody's in a facility, one of the biggest, I wouldn't say problems, but one of the biggest workflow issues for a facility is the calls from friends and family to check in on the member. But if they have this clinical aspect with a care coordinator and the clinician coming in and checking on that member, it reduces those calls by a great deal. So that's the other benefit to a facility and why they would want to offer this plan. So again, just to review, plans available for those that are institutionalized, those at home as well, though, based on any of those qualifications I talked to. So in other words, widely available. How do you get ready to sell this as an agent? Well, there's 2 steps to take. The first is to watch a video. So you watch a video, it's a short video, and then you scan a QR code. Once you do that, then the module, because this has, like any MA product, it has a certification. It's UHC, but it's an invitation-only training to be able to offer this plan. So once you scan that QR code, give it a couple days, and then that certification module will be loaded into the invitation-only section on Jarvis. So once it's in there, then in the Learning Lab on the invitation-only section, then you can complete that certification. And like all MAs, you got to do it every year. It's not like, so you got to do, if you want to sell the plan this year, because it is available in the states I mentioned, if you want to sell it this year, you do this year's 2023 cert. Then you have to do it for 2024, just like any other plan. Once you get set up, you'll get an invite. Once you certify, you'll get an invite from WellSky to register, and you can order supplies through Jarvis or call our office or call Pinnacle to order supplies. Enrollments can be done either through paper or lien. This product will be added to Connecture and Sunfire soon. So you'll be able to enroll through both those platforms soon with this product. And again, this product, you have to be contracted through us or Pinnacle to have access to this and to be able to sell it and receive compensation for it. So what's the bottom line? It's a dual-like product. It's available to both duals and non-duals. So if you think of a state, any states with higher out-of-pocket maxes on the majority of their Advantage plans. I mean, the state where I'm in, Connecticut, New York, Pennsylvania, New Jersey, I mean, there's a number of them. States that have 6,700, 7,550 out-of-pocket maxes. You'll be able to offer a plan with a $1,500 or $1,600 out-of-pocket max competing with those plans. A no-brainer. The plan has a premium. It's about $35 a month. But even with that premium, do the math. 35 times 12, add it to the out-of-pocket max, it's still a far better benefit. If anybody has any level of help, so if they have, if they're a QMB, of course, full dual, if they're a SLIMB or even in states with ALMB, any level of drug help, it will pay the full premium of the plan, so the plan will have no premium. People have asked me, what if they're a QMB or a full dual? Well, then there'll be no out-of-pocket because it operates just like a dual plan. No copays, no out-of-pocket max. But for your drug help only people and your no help at all people, that low out-of-pocket max and all the extra benefits will be a huge selling feature. Okay, what I'm going to do now is show you an example of the plan. So remember, We put the recording on YouTube at Crowe Medicare. Remember to take AHIP. We have a discount for AHIP, so you can get access to AHIP for $125 through our link. And we're going to take a quick look now at the product page for this product. Let's see. All right, let me show you. So this is the website, pfsinsurance.com/UHC-IESNP plan. We will send you the link for this. And what it shows you are the features of the plan. In the section I'll go to there's a couple. So there's a link to get ready to sell. When you do this, it will show you the steps to get ready to sell. That includes watching the video and scanning the QR code. And then it will give you instructions after that on how to access the invitation-only certification through Jarvis. Why sell the plan? That's where you access the benefits. So this will show you the states that are available currently. But again, as I showed you the map, it'll be available prior to AEP in 20 states. But these are the current states. And it gives you an example. Like here are the counties that's available in New Jersey. You've got the transportation, $175 a quarter OTC, $2,000 hearing, $3,000 dental, $1,600 out-of-pocket max, zero copay on a lot of prescriptions, generic prescriptions. And we're going to add the link to the summary of benefits here very soon. Let's go down to a page, New York, for example. So it's in two sections of New York. It's in Western New York, Western and I'd say kind of upstate New York. But here's downstate. So same thing. It gives you the benefits of the plan. If you want to see the summary of benefits, you just click right there. And there will be the summary of benefits. It's zero copay on skilled nursing, so zero copay for 100 days. As you know, most skilled nursing plans, after 20 days, it has a copay. This one does not. I'll let you look at this on your own time, but you'll see, obviously, very good benefits, really low out-of-pocket max. Let's give you another quick example. So you've got New York, Western New York, upstate New York, Pennsylvania. And again, more counties are being added, and obviously a lot of states are being added prior to AEP, as I showed you on that map. There's Connecticut. Only 2 counties in Connecticut. We're hoping they add more prior to AEP. And there's Florida for you. And as you can see, in Florida, the OTC is $240 a quarter, for example. Okay, so here's how you become ready to sell, and then the how to sell the plan. We'll go over step by step the verification process to see if somebody's eligible for the plan. There's additional information down there. We'll be adding more. You'll be able to get supplies through Jarvis for this plan. Okay, let me go back and see if we have any questions. All right, I think we have some. Serena said, yes, come join us for the Lunch and Learns. Okay. Somebody asked, will we get an email on the Lunch and Learns? Yes, I believe an email will be sent to you, so be on the lookout for that. Serena, I know you're muted, but, send that email out. Is there any idea yet when county expansion in existing states? Yes, there will be a tremendous state and county expansion prior to AEP. Connecticut is in question. It's already approved, so we'll have Fairfield and Hartford County probably by the end of this month commissionable. It's already actually, you can sell it. It's just not commissionable there yet. As far as additional Connecticut counties, I don't know. New York will certainly be adding additional counties for the person asking the question. Okay. Can the public call UHC and enroll in this plan without a Crowe Pinnacle agent? No. No, they cannot. And then Serena said, will do, and that's regarding sending the emails out for the Lunch and Learns. Let's see. I have any idea when these plans will show up on Sunfire Connector? That's a great question. I was told any day now, but I was told any day now for a few weeks. So I guess, it's kind of subjective. What's any day now mean? I don't know. So any day now, Alex. Do we have any other questions? Let's see. Happy to answer any if you have some. And again, for the map I showed you, maybe I'll go back to it for a minute. The plan is available now in the following states. Hang on. We'll go to the map yet. So it's available in New York, Pennsylvania, New Jersey, Connecticut, and Florida. And just go to the Pinnacle, that page. We'll email you the link to it, and you can look and see what counties it's available in. But here's the expansion map for 2023. So by AEP, should have the expanded states, expanded counties, and then the new states for 2024. It looks like, oh, we do have one more question. Ed, what is your best advice for a first-timer to pass AHIP? Okay, yeah, it's very simple. Go into each module, save the module, because you can save it. You can save the PDF of each module. So save that, and then go through all the test questions. There's 20 on each module. Go through the test questions and just remember what the answers are for all of them. Those are the same questions you'll have on the test. And that's the best advice. I mean, the test is easy if you do that. So if you remember all your test questions, go through the answers, understand why you got answers wrong, understand what the right answer is. When you get the 50-question test, you're going to get the same questions. You might get one or two oddballs, but they're going to be everything you went through. So it is pretty easy to pass if you take that strategy. Let's see if we have anything else. Is the network the same as the regular PPO? Yes, is the answer to that. So that was the question, is the IESNP plan PPO network the same as the standard PPO? Yes, is the answer. Okay, it looks like that's all we have for questions. I greatly appreciate you coming on today. Tomorrow, what am I saying? We're going to have an agency Zoom meeting Tuesday. For those who haven't attended that, it's quick. I talk for maybe 10 minutes on just various updates nationally on topics, and then we just open it up to questions. So unlike this webinar where it's just me talking the whole time, on the agency Zoom, feel free to ask any questions you want, bring up topics. It's more of a dialogue and a back and forth. So I prefer those. It's way better than just talking it myself on a webinar. But feel free to join us. We send out the registration links for those, and they're also on our registration events page as well. Thanks for coming on today. I appreciate it, everybody. I hope you have a wonderful weekend. And if you have any questions, give us a call. Thank you.